At first I thought, okay, it's breast cancer. I can cope with this. I was asked to have surgery first. So I had a lumpectomy.
Mm-hmm.
It was a stage 3 diagnosis. So it meant they were able to remove the tumour and preserve the breast, which was wonderful. But on the other hand, I was very mutilated and I didn't look in the mirror. I cried. I did not look in the mirror. I felt mutilated. I felt ugly. I felt unloved. And I remember my husband saying, "You're okay. I'll be your eyes." But he helped me to keep saying, "You're looking gorgeous. It's fine. It's healing." I did go on to have chemotherapy. Adversity teaches you.
Yeah.
Adversity teaches you. I was very blessed. I had a family that were non-judgmental. They walked alongside me, but they were broken too.
Yeah, yeah.
You know, I saw moments when they too were in pain and said, "You're not going to make this. You're not strong enough." And I just laughed. I went, "I'll get hit by a bus, but I'll come through cancer. Trust me."
Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune into what really matters: your body, your well-being, your life. No one-size-fits-all advice, just real conversations to help you understand your health on your terms. But before we dive in, I've got a quick favour to ask. Please hit subscribe and join the 51% community on our website. It's free and helps us grow, reach more women, and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared is for information only. It's not medical or financial advice, and always speak to a qualified expert for support that's right for you. Samina, welcome to the podcast. It's great to have you on. Thank you so much for joining me today. Could you please introduce yourself and talk about your journey from where you are and also your journey with breast cancer, of course, to what you're doing now? That would be great. Thank you so much.
Yeah, brilliant. Thank you for having me. I'm Samina Hussain, and I've had a 10-year cancer anniversary. So I've just completed 10 years cancer-free. Yay! So it's been quite a journey.
Yeah.
And I'm the founder of Sakoon Through Cancer. Sakoon means peace and tranquility, supporting predominantly South Asian women, but all women through breast cancer and women's health. That's my focus. And I think when I was diagnosed, I was age 45. I was a mum, wife. I was married at 16, child at 16. I was a grandmother. I think I had 2 grandchildren then. At 45 years old, I was working in local authority. Life was just in the fast lane.
Yeah.
I didn't matter. And then suddenly, it was actually my husband, bless him, who found a lump. He said, "You've got a lump in your breast." And I went, "Don't be silly." And he said, "Yeah." And I made I then sort of that night, I remember just sitting up all night thinking, what's this? Oh, is it there? Is it not? And then obviously on to the doctors in the morning. Now, one of the things was my childhood narratives, my cultural upbringing as a Pakistani Muslim woman. I think I had so many narratives that I didn't realize governed me so strongly.
Yeah.
So, for instance, when I rang the GP, they said, "Oh, Mrs. Hussain, there isn't a female doctor for 5 days, and we can get you in to see a doctor this evening, but it'll be a male doctor." I went, no, can't do that. Because as a child, you didn't show your body parts, let alone your boobs, to somebody else.
Yeah.
You know? So it just felt very uncomfortable. This was medical, but my brain hadn't registered. Luckily, my husband was standing behind me. He goes, "What are you doing, woman?" I said, No, I'll see them on Friday or Saturday. He goes, "No." He said, "Ring them back.
Yeah.
You will go to the appointment today and I will come with you. I cannot go through the next 5 nights of worrying about you." And I was like, oh, you are right. Why did I say no? So I think I embarked on a journey that I realized a lot of my life was surrendering to others. So I didn't matter. When you get married at 16, your whole life changes.
That's young, and I'm assuming, especially back then with the South Asian narratives, it's almost kind of like a given that you will get married. It's not really so much a choice.
It's not a choice in terms of marriage per se.
Yeah.
But in the sense of, I was quite fortunate that, you know, the way it all worked out, and the person I was marrying, I've been married 40 years now. So we've just had our 40th wedding anniversary. And he's such a good man. I mean, I think God sent me a soldier to walk alongside me. But a lot of it was me, because I'd surrendered to the narrative and felt that you just sacrifice everything for your home, family, country and everything. You forget that actually, hang on a minute, I too can say no to things.
Yeah.
So I don't actually blame him or think it was him, because it wasn't. It was me not stepping into my power. But also it was me not loving myself.
Yeah.
I never loved me because I didn't matter. And that's the absurd thing, that what cancer did, it allowed me to stop. And I say the treatment was horrendous, what I went through. But actually, the purpose of cancer did what it needed to do. God's plan was, right, woman, you need to slow down.
Yeah.
And you need to focus on you now. And I remember putting this very sort of invisible ring around myself, saying, I can't do it anymore. I'm just enough for me. And that sort of helped me to redraw my boundaries around who I am, where I want to be, what do I need from life. But very much about thinking about the fountain and giving from my overflow. See, often South Asian women, we just pour from an empty cup.
Yeah.
Because that's what I was shown. My mother did the same, you know, aunties, women, females around me, you know, you rallied around and made it happen for everyone else. And I think that was what I was mirroring. But that wasn't my joyous moments. But the treatment itself, at first I thought, okay, it's breast cancer. I can cope with this. I was asked to have surgery first, so I had a lumpectomy. It was a stage 3 diagnosis, so it meant they were able to remove the tumour and preserve the breast, which was wonderful. But on the other hand, I was very mutilated, and I was cut under the arm. I felt so sore, and I didn't look in the mirror. I cried. I did not look in the mirror. I felt mutilated. I felt ugly. I felt unloved. And I remember my husband saying, you're okay. I'll be your eyes. And he helped me to really, it took months, but he helped me to keep saying, you're looking gorgeous. It's fine. It's healing. Because, again, it was something very personal to me. Your breasts, your body, your shape, who I was. This was something intimate to me. And suddenly somebody's just come in and literally chopped me about and told me that I have a cancer diagnosis. I then went on to, I thought that would be the end of anything else I needed to have, but sadly not, because there were some lymph nodes and there was other complications. So I did go on to have chemotherapy. And chemotherapy, again, that's where I put on the weight. I put on about 20 kg of weight. My mobility was slow. I obviously rocked it bold. But I was the only brown woman in chemo.
Really?
Yeah. I didn't see anyone else until I was on my last session. But there was hardly anybody there. So I assumed breast cancer didn't affect South Asian women. We don't get it. This is very uncommon or rare. But actually the data shows the prevalence within predominantly Pakistani community, or the South Asian community, is quite high. And in Pakistan. So I was quite shocked that how come I didn't see other women? And I remember talking to my breast care nurse, and she was saying, do you know what? They do come, but because of cultural narrative, taboos, the lack of awareness and speaking out early enough, people present late. And for some, the outcomes are quite poor.
Okay.
So it could be death. And I was like, wow, that's shocking. And so she said that, you know, it's about that constant raising awareness. And I just thought to myself, now this is troubling me. This is giving me something that's saying, hang on, that's not right. So I started to share on Facebook. So pictures of me rocking a bowl, pictures of me having chemotherapy, and everyday life, the 3-week cycle. And quite a few women reached out and said, lots of love and prayers, thinking of you, which was lovely. But my mother died from breast cancer, and we were forbidden to talk about it.
Your mother?
These women.
Oh, these women.
Yeah. So the women that reached out on Facebook were saying to me that actually following you and reading your story has been quite humbling and healing, because their mothers died from breast cancer, but they were forbidden to speak about it. So it was literally, funeral happened and they had to roll over the next day and get on with life. That actually felt much harder than actually getting my own diagnosis, because I was then starting to understand, as a community, where have we come and how far we have not come. You know, it felt like I was back in the Victorian days of, you know, not talking about anything that was related to women or women's health or sexualized in any way. So, yeah, that really did then spark me to think about, well, how do we normalize this? How do we make it easier for people to see other women's stories and journeys around breast cancer? Because if we're not visible, how are we going to know what the health inequalities are for these women? How will I meet more women like me in chemo? I mean, God forbid, I don't want anyone in chemo, but actually I'd rather have them in chemo than not have them at all.
Yeah, absolutely. So how, you know, you mentioned that your husband found the lump. Were you checking your breasts prior to that? And if you were, how often were you checking? Because this is another issue, you know, South Asian women and I'm sure other cultures, they don't check their breasts. And it's a taboo thing, right? You know, I'm hoping that things are changing and people like yourselves are making things change. But how did it work for you in that sense? Were you checking?
Never knew about checking, didn't know how to. Nobody ever mentioned it in my 45 years of life.
Really?
Yeah.
Wow.
Nobody mentioned it, not even when I went to the doctors for a diabetes screening. So there was no holistic assessment of, and just to remind you, I do remember the smear test and being asked and invited, but nobody in any of the talks said to me, are you checking your breasts, Mrs. Hussain? And do you know how to? Here's a leaflet. No. And that was the shocker, that, my God, I don't know how to do this, and no one's mentioned it. And I never, ever saw any TV adverts or radio or articles about self-examination. And that's why I embarked on creating a education program in schools for PSHE lessons when we go into secondary schools. No longer, I've stepped down from being co-founder of Sakoon Through Cancer, from Knit Your Socks Off, because obviously things are now evolving. But we set up Knit Your Socks Off because a friend of mine made me my first chemo socks, and I took them in when I was having chemo, and they were just a home handmade pair of knitted socks. They were bright pink. But what that did is it just created a bit of fun within the chemo room unit, and they would say, oh, we love your socks, and it just created a bit of conversation, but it kept me warm. It meant I could move around without having to put slippers on, and I'd have a little shawl, I had a little beanie to keep myself warm or strip off as needed, and that's what I then did. Is so for me, being South Asian, it's about dignity, and it's about making sure that however we present things, that it's not sexualized and it is seen as this is a serious conversation. So when I devised the program, one of the things I thought about was taking in knitted boobs and having them in different colours. So, the skin tone depicted the South Asian skin tone. I'd put a marble in it to represent the sort of finding of a lump or a tumour.
Yeah.
And as I do my talk, I talk to them about how to self-examine, and then I throw the boobs out, the knitted boobs, and get everyone to have a go.
Yeah.
And it sparks lots of conversation. Mrs. throwing out boobs and what she got on her desk. But I do this for the boys and the girls. So it's the young men in year 12s, 13s, and the ladies, because for me, it's so important we take the male community with us from all communities, because they too will be the champions. They too will be the allies for the women in the future, for their mothers, grandmothers, sisters, aunties, girlfriends, wives. And that's the only way we're going to build a community, is to keep allowing people to have safe spaces to talk about, self-examination. I'm still shocked that I got to 45 and I do not recall even one conversation around self-examination.
Yeah. I mean, I'll be honest, I'm in my late 40s, and growing up, there was no conversation. It wasn't discussed within my family. My mum never mentioned it. I mean, I didn't even know about periods, to be honest. It just wasn't talked about.
Sounds like me.
Yeah, honestly. And, I had no idea. I only kind of became more aware of checking your breasts a lot later on in life. And, I just think it's so shocking that I feel like it needs to be integrated in your doctor's visits.
It should be a holistic assessment.
Yeah, exactly.
And it should be a part of the school curriculum.
Yeah. Oh, yeah.
Everyone. I know NHS England have just done their first Take Your Bra Off campaign on breast cancer and getting anything abnormal checking. And I'm thinking, if that's your first campaign, this is quite late from all parties in raising awareness.
Yeah.
And I think by me sharing my story, allowing, especially in the area and the community, predominantly ethnic minority communities, people actually now have become that pivot in the community where people will say, oh, talk to Samina. She might be able to help you or direct you. And that's a safe space for me, because it's like, look, no one should do cancer alone. It's a very lonely journey. It's quite a heartbreaking journey, because a lot of the what ifs keep coming back to you.
Yeah.
What if, I had my consultant appointment last week, 10 years, and I just felt immensely proud that I'm sitting in this chair, I'm seeing you. And he said, you're always positive. And I said, well, maybe that was the energy that carried me. But the fact of the matter is, there's so much advice out there once you're diagnosed. Actually, that too becomes a problem, because it becomes overload. And with chemo brain, where your brain is so fuzzy, remember I was 22 kg heavier, everything was slower. My bones ached, I was vomiting, side effects from chemotherapy, which, can be really destabilizing every day. So it took a while. It took a long time for me to even sort of, understand, oh my gosh, what's happened? Where am I going? What do I need to do? Because I'd lost my spark. I'd lost my identity of who I was, of mum, grandmother, wife, Samina Hussain, Pakistani. I'd lost all of that, was stripped overnight. And I was this bold, rocking Asian woman that was very heavy. And when I lost my eyelashes, I remember my eyes were absolutely streaming and they were sore. And it just made me be very grateful that I now know why we have eyelashes, and it's not just for mascara.
Yeah.
It's to protect my sight.
Yeah.
Some of the side effects, the bone pain, which I'm still suffering with 10 years on, bone pain, neuropathy, arthritis, things that have evolved, life beyond cancer. And that's the thing. There are things that will still stay with you that you just can't do anything about. You've just got to manage them as long-term conditions within your everyday life. And that's why, again, I'm a strategy advisor on lived experience for Macmillan Cancer. And I'm really pleased to see in their new strategy, they are talking about long-term conditions and aligning to recognise. Because once you finish treatment, it's a bit of a cliff edge and that's it. Nobody wants to know you.
Yeah.
And they think you can just tip back into work. But for me, that was the most hardest transition. Because if I always did what I did, then that's what I got. I didn't want that life.
Yeah.
I remember for a long time I didn't drive. My husband kept worrying, thinking, what's the matter? I said, do you know what? Driving for me associates with busyness and chaos.
Yeah.
And I didn't want it.
Especially in London.
Yeah, I just didn't want that.
Yeah.
You know, getting back onto that gerbil wheel of constantly running. I'd suddenly been hit with this whole diagnosis and treatment that my life wanted to do something different. And I remember walking and hearing the birds sing. I remembered hearing children, you know, playing in a school playground. I could hear the noises. You see, I've always worked since 16, even having children, bringing up a family. I've always worked full time. And we didn't have COVID in those days where you worked from home. You know, I worked in an office.
Yeah.
And if you ever said you were having work from day home, they'd look at you as if to say, oh, yeah.
Yeah, oh, yeah.
It's a jolly.
Yeah.
But, you know, I was always working in an office. So, you know, suddenly I was presented with this time to actually rethink, what is it that I need to do? So, yeah, and then, you know, I often say life's not about waiting for the storm to pass. It's learning to dance in the rain. And it was dancing to understand, okay, what is this journey teaching me? And there's a lot of resilience. It was about, you know, people say to me, you're so brave. I don't know if it's bravery or it's just really aligning your faith, your identity. I mean, July is South Asian Heritage Month, and that's beautiful because actually I've become more confident in standing for who I am as Samina Hussain, as a South Asian, coming from you know, a family of that migrated from Pakistan, Karachi. I remember my dad came in the early 60s. And it's just...
Were you born here or in Karachi?
I was born here. My sister was born in Karachi and she came over at 20 days old.
Oh.
You see, my mother buried 6 children before she had us.
Wow.
Yeah, so they were born and then she would say they would get to about 4 months or 6 months and they died.
Yeah.
So, but she told me at the time it was poisonous breast milk. There's no concept. And when I had my 3 children, I didn't breastfeed my children. I was fearful.
Oh, no.
And I know there is a correlation between, you know, in terms of preventative, that breastfeeding is good in order to reduce your risk to breast cancer, is what I've heard. But I never did that. I never did that because I was fearful.
Yeah.
But then when I look at the clock forward now, I have 11 grandchildren. I love them all.
Wow.
3 children of my own and 11 grandchildren. And then about 5 years ago, my son and daughter-in-law gave birth to a little boy called Issa. And Issa was very ill. And he ended up at Great Ormond Street. And it was during the pandemic. And I was on furlough, so I could help because my daughter-in-law was pregnant again. And Issa needed to have a bone marrow for a very rare condition called LAD1. And what I learned through that process, even though genomics, genetic testing, they don't go back as far as my parents.
Yeah.
But children in India and Pakistan that are diagnosed with LAD1, which basically means they don't have any white blood cells, die. They're given a death sentence.
Okay.
So that, in a sense, you know, when you have something untold and not actually quite making sense from the facts given to me, I realised actually that's what mum's children had, or my siblings. and they didn't have a chance to survive because they didn't get the treatment like my little man Issa has had.
Yeah.
So Issa is the first child in the UK to go through gene therapy.
Oh, really?
Yes.
Aww.
And recently he's just done his 5 years. The research study has shown it is a massive breakthrough for lots of children with complex needs and long-term conditions or cancer-related, which means then, you know, sometimes I remember saying to my son, and he said, it was COVID, the only bone marrow in match they got was in Italy. They weren't allowing organs in and out because of COVID.
Of course, yeah.
And this trial came up. It was such a blessing at a time when we thought there was no option. And I said to him, sometimes in life, you've just got to tie the camel. So in Islam, we look at, you know, there's a Hadith, a Quranic verse that talks about tie the camel, which is put everything in your power, then leave the rest to God's hands. And that's what we literally blindly had to do in choosing Issa's or confirming Issa's treatment of gene therapy. And I remember, you know, having this conversation with the professor at Great Ormond Street, Claire Booth, and she said, wow. And I said, you know what? We don't know what tomorrow's going to bring, but all we can do is just hope and pray for the best. Issa had his complications, but he's thriving now, you know, and I just think resilience, you know, children have so much resilience.
They do. Yeah. Yeah.
And I'm sure we had it too, but I felt like what my journey and what my experience of my family and my cultural heritage and everything else, what it did is it brought my ability to be resilient right at the top of the list and not get bogged down with the toxic, you know, relationships or arguments or conflabs that I just didn't need to be involved in anymore because I stepped out of that ring of, actually, this doesn't serve me anymore, so that's okay.
Yeah.
So, yeah, you do learn that things are sent to try you and you will come through. But at the time, you just don't know what that's going to look like.
Yeah. Yeah, of course. It's hard to feel like there's a way out when you're in a situation of challenge. And at the time you're thinking, you know, whatever that challenge might be, whether it's to do with your health or, you know, mental health issues, it could be anything. You feel almost like, how am I going to get through this? What am I going to do? What can I do? And it's almost like you think there's nothing I can do and this is my life now. But like yourself, you know, you are where you are now, which is absolutely amazing. And you know, you have the important thing that I'd like to point out is, you know, your family. Yeah. And that is so important, you know, your husband, your children, and that would have really helped you, because if you didn't have that as the foundation,
definitely,
you know,
I mean, adversity teaches you. Adversity teaches you. I was very blessed. I had a family that were non-judgmental. They walked alongside me, but they were broken too.
Yeah.
You know, I saw moments when they too were in pain and said, you're not going to make this. You're not strong enough. And I just laughed. I went, I'll get hit by a bus, but I'll come through cancer. Trust me. And I think, you know, my daughter was in her university at the time, and she literally was that soldier. She was sorting out house, sorting out dad, sorting out me, whereas I was enough for everyone. But I had to pull away and put that ring around me and say, I can't do this anymore.
Yeah.
And she stepped in. I mean, she's a mum today, and I'm just so proud of her, the way she masters things. But I think, and she says, you know, that time of just working through the adversity of the cancer diagnosis, it actually, she said, it strengthened me to find hope.
Yeah.
And that's what we have to focus on in life. There is hope in everything. When I saw Issa having 3 cardiac arrests and at Great Ormond Street and with his condition, the only thing I could do is have hope. And I saw myself in chemo and I couldn't move and I was in pain and I didn't know what tomorrow would bring.
Yeah.
But I had hope. I had my faith. I had loved ones. And that's all that mattered.
Yeah.
Because I just thought, you know what? I'm really blessed. And you talk to other people in chemo, other women, other men, some were very, very isolated and lonely.
Yeah.
They didn't have family. I was isolated and lonely because as a community, it was taboo and nobody spoke about, and there was shame attached. So I couldn't just openly say, oh, I've got a breast cancer diagnosis.
Yeah.
Everyone would say, oh, are you know, why are you saying that? Don't say that. And I'd be like, but that's the truth. You know, people would come and see me and they'd find it really hard. They'll visit the sick, but they would find it really hard to say breast cancer. And I'd be like, let me say it for you. It's breast cancer. It is fine. And the other thing you learn is that even family, even loved ones, girlfriends, good friends, they all find it really hard to watch you on this journey. And that's okay. And for some, I had to just stand them down and say, it's okay, please, you know, don't worry, I will come through this. Because if they've had quite a traumatic journey and it's been quite triggering, if they've lost lots of family members to cancer, I could understand where this individual was coming from. She just said, I can't believe it's you. Why you? I said, well, that's God's plan. You can't choose what tests or what adversity are going to walk in your path. You just can't. But sometimes you have to be kind to yourself and kind to others to understand that they're not doing it because they want to prove a point or they're not. They just can't get past their own trauma of what they've seen in life. And then what happened, because I was sharing on Facebook, other beautiful souls just stepped up. People from where I went to school. There was a family of sisters that were like, right, what can we do for you? Let's take you out for coffee. And you just think, where did these little smurfs come from? But that was beautiful, to wrap you with gratitude and love and know that, okay, what do you need? You just need half an hour to come out and have a coffee because your life changes. I mean, I know we had a bit of that in COVID, that people didn't, you know, go out in open spaces or be with people. When you're going through chemo, you can't go anywhere because you're so at risk of picking up infections, becoming neutropenic. I would spend at least a week every month at Wexham Park or at local hospital because I was so poorly. My blood count would drop and I'd be very unwell. I did end up with a blood clot as well. So that meant I had a long stay at the hospital. So these complications that you can't even plan for. And also everyone's cancer journey, everyone's treatment plan is completely different.
Would you say with chemotherapy, there are, you know, differences in how people react with obviously their heritage, you know, if they're from South Asian community, if they're Black, if they're white, and also is there like a standard list of, you know, if you're going through chemo, these 3 things will definitely happen. The rest is kind of ambiguous, or there's a bit like menopause, you know, these things could happen, but there's almost like 50 plus or God knows how many menopause symptoms that you could possibly get.
It's risk stratification risks. Everybody or every individual will react differently. I mean, I saw women where their nails fell off. I was fine on my hands. I lost a toenail, but my hands were fine. People were having manicures and, you know, just to protect their nails. I think, you know, even your hair you can preserve if you do cold capping, and you can have that where they put a cap on to freeze the cells under your hair follicle.
Oh, okay.
So your hair doesn't fall out. But for me, I just went, no, that's fine. I really don't want ice on my brain while I'm going through everything else. I mean, that's how I interpreted it as. And I know I'll be vomiting even more so. So I think, I mean, you know, some people will lose weight with chemo. Others, for me, I put on a lot of weight and was slower. I think, you know, there will be a whole list of side effects. Which one of those you're going to get in your bucket? I don't know. Because it can vary. I can tell you what were in my bucket, and some of them still are there, and I can't get rid of them. But everyone is different. And also, again, South Asian communities, men and women, we don't put ourselves forward for research.
No.
So we're underrepresented. And what that means is then, even tamoxifen or even the chemo drugs or alternative therapies or whatever, none of that has been researched on South Asian DNA, cultural heritage, background, blood sampling, because if there's the pool of people are not there, well, they're not stepping forward. So I have done quite a bit of extensive work with Macmillan around. It's that conversation and engagement. It's about explaining it. Why? What's the benefits of engaging with research? We've just done a video for Our Future Health, and it's an NHS program, and they're getting people to step forward to get blood tests done and sort of a basic test to do a baseline. And what that does is it checks and it enables them to predict across all communities what the prevalence will be of different cancers, different illnesses. And I'm so passionate that I think we need to keep actively being involved in research and championing our fellows communities to do the same and not be afraid of research. It's not going to benefit us today, but it will benefit our children, our grandchildren, future treatments, innovation, diagnosis. And the journey of cancer and its diagnosis and the treatment plans have come along vastly. But that's only possible by having that correct research and understanding, so that more things are more like minimize side effects and have a better outcome for patients.
Do you think, just a thought popped into my head when you're talking about research with South Asian women or men, do you think it's possible to pull research from, and that's if there is research, from India, Pakistan, Bangladesh, these communities abroad? Do you think there will be differences? Because if you're born and raised in the UK, there may be slight differences in obviously the diet, and I mean there's lots involved, right? So
So I think there is, and there's lots of international great reports. Shaukat Khanum in Lahore it's a cancer hospital, and they do a lot of research and innovation. There's in India, so we've got a doctor that's in Malaysia doing a lot of interesting work. But you've got to remember, when you're living in the West, you will attract the disease of the West.
Yes.
Lifestyle, working hours. So if I lived in Pakistan, my father never migrated in the 60s. Maybe I would have been in the Punjab, in a village, being a mum, housewife, having nice clothes and just sitting around and the maid coming to do my cleaning and my cooking. I wouldn't be working. I wouldn't be driving. I wouldn't be rushing around. I might have been driving. I think the world has changed there. I wouldn't be exposed to technology as much. Toxic environments, fuels, environment. So my lifestyle would have been, I would have grown my own crops because we're farmers. So I would have lived a very organic lifestyle. Even the meat would have been organic. Not vegan, but, organic.
Yeah, I know what you mean. Yeah.
So I think they live longer. And I think those that are living in rural areas actually live longer and a stronger life or a healthier life. Now, if you were to do research on all of those and apply that to the UK, you're not going to get the same comparators. Because our lifestyle here is, since 16, like I said, I've worked full time, brought up 3 children, hubby, family, extended family of about, cousins, sisters, siblings, their partners, children, their grandchildren. It can go on. I reckon if I tried to get everybody, we're about 100 of us to fit into my house or a hall. So, it's just madness. But we don't. I think it's not as straightforward as that. But I think we have to keep building that DNA and understanding and identity. And that's why Our Future Health or other research projects that Macmillan, quality of life programs that I'm co-chair of now in London, it's doing a lot more of understanding personalised care and quality of life. So one of the other things that's worried me is this absence of conversation within families, the taboo of community. When I was diagnosed, I asked here and in Pakistan, has anybody had breast cancer in my family? My parents died when I was very young. And they all went, no, you're the first. oh, really? And they said, yeah, you are the first in generations to have cancer or breast cancer. Because we have a lot of heart disease, but we don't have cancer.
Yeah.
Which I knew that much. And I remember sort of looking at my husband saying, this doesn't sit right with me. A bit like I didn't see brown women in chemo. This doesn't sit right.
Mm.
And he just took this long sigh. He said, what you don't understand is people died from cancer. They were buried, but no one spoke about it. The words were never uttered.
Yeah.
After the funeral prayers or anything, nobody ever vocalized, what did that woman that we've just buried die from, or that man? It was just never shared.
Yeah.
He said, so you don't have that full medical record or history, which then means when I do my genetic testing, BRCA1, BRCA2 gene, and do the answering of the questions, I have to say, well, I haven't got any family history.
Yeah. Which may be incorrect, like completely incorrect. Yeah.
It's nonsense.
Yeah.
But there isn't any, yes, I could go privately, but that's not going to help other women like me that are in a system. So this is about creating change, to say we need research to understand the prevalence of South Asian communities and women at screening. Can genetic testing be done to try and identify, is there a pattern? When I did a focus group about 18 months ago, all of the women, and this was done for Macmillan, that were diagnosed with breast cancer that came to the focus group were under 45.
Wow. Okay.
And that was just doing a call out and saying, anybody like to come to a focus group and I'll give you a little voucher and come and tell us you. And I was shocked because when you, at that time, the images in their books, even those that depicted South Asian women, were of an older woman with a chunni or a shawl on her head.
Yeah, yeah.
But that's not reality, because the women were like dudes like me that were, a room full of women that were all from an Asian population that were under 45 and some even younger. So I think this is why understanding data, demographics, understanding research is to keep abreast of what is the image and the picture of the community that are now being diagnosed. And I just think it's lifestyle. It's the craziness that we all go through and living in the West that actually is what causes disease. So yeah, that's the other thing that really stood out to me, is this is really quite shocking. In the absence of data and understanding, look, I've got a room full of women and they're all very young. And some of them have been diagnosed twice or three times. So they were thrivers. And you were like, gosh, to have had a cancer diagnosis 3 times is heartbreaking.
Yeah.
So, yeah.
That, I don't know, I feel like, how do you get past that? And how do you make sure that, you can't make sure that for, every South Asian woman to you can't reach everyone, obviously. But how do you think we can get that message out there very quickly and amplify it? I mean, for me, all I can do is make sure my children know and are aware, and also make sure they're checking their breasts even at a young age, And the
boys and males, because males get cancer.
Cancer. They do.
Yeah, the numbers are small. It's about 330. But again, it's just that awareness.
Yeah.
I think the work you're doing is amazing. Podcasts. I don't have the skill set to do a podcast or even work out how to set one up. But the fact is, you're giving women like me or charities like mine the platform and the space to have that conversation and do it impartially, that there's no shame attached.
Yeah.
I think for me, I'm really passionate about women's hubs and safe spaces because, the women's health strategy, the women's health agenda has talked about women's hubs. It's not quite mobilized in many areas, not even in my own hometown of Slough. But I think I've set up something called Rotti Club, which is a culturally appropriate supper club. What I love is it's for women that have had a cancer diagnosis, women that have been carers for somebody that's gone through a diagnosis, and for health professionals. And for me, carers too embark on a journey that is so painful for them.
Yeah.
Having watched my daughter care for me, that they too need a safe space to talk to others and to share their story. And what is so powerful, and it's quite a simple concept, extend my kitchen table. Michelle Obama talks about it quite eloquently around just keep inviting different people and allow them space to take a seat and have some food. And we'll bring in different speakers if need be, or topics around menopause, around anything from weight loss to vagina dryness to what impacts you, and just keep evolving with that model around allowing people the space to gift themselves a safe space and know that what is in this room. We use a college catering unit, which is a restaurant, and we set it up really nicely. And the reason is it's empowering women to take stock of their own health and well-being. See, again, as a child growing up, married at 16, that was something that was very absentee in my life. I've actually now lost quite a bit of weight, and I've been joining a women's only activity program, Limitless 24, and doing weight loss. And I've been not weight loss, but I've been doing weight management, in the sense it's about changing my relationship with food, and doing weights and doing, I love my boxer size, beating up. It's great fun. Just finding strength-based, strength I never had in mind, body and soul. I'm also a mental health first aid practitioner. So, for me, advocating good mental health, really important for all of the communities I connect with, women and men. So I think it's rewriting your own story, manifesting, tying the camel to know that actually this is where I want to be and this is what I want from life. My life outlook now is about just living in the moment, being the best version of myself, and ensuring that actually whatever I do, whoever I connect with, I can bring goodness to myself and to others. But also recognizing when things are not at that level of goodness, then there's a reason, and you can let go. And letting go shouldn't be a hard, painful, traumatic experience. It should be, actually, that's served its purpose now. It's time for people to get off my bus, or for me to get off the bus. And that's okay. So it's about really giving yourself kindness and gratitude. And I really believe that if we start with ourselves, it will just emanate wherever we go, and we'll be able to have a profound impact on others. So the Rotti Club has been going over a year now, and the concept is very simple, but actually I get women now, about 30, 35 women each month, once a month, come together, and they love it. And they just say, we've never, this is so different to be able to be in each other's spaces and know that this is what we're here for. And the reason, I feel that you having that mix of combination means that people don't feel exposed, that everyone in this room has had a cancer diagnosis. Well, some may be. We've got a couple of GPs that come. We've got a chief medical officer that comes. We've got carers that come, then my volunteers that support. So it's a beautiful energy to allow people to just think about, what do I need next? So there's lots around Asian diet, nutrition. You get told a lot of things when you're going through chemo or treatment. Well, if you eat this, that will cure your cancer. Myths and stuff that I'd never even heard of, and fruits and foods. But my heart kept saying, well, if it was easy as that, then people would have done this years ago. We'd eradicated cancer by now. But it doesn't work like that.
There's obviously lots of things you can do, but there's no kind of one cure that, if that was the case, we wouldn't be down to, like 1 in 2 now. It's, it's exactly, it's crazy. And this is why we need to get the message out there very quickly, because 1 in 2, that's
1 in 2 people in the UK, England, Scotland will get cancer. 1 in 7 will get breast cancer.
Exactly.
So the prevalence around breast cancer and women's cancers, it's breast cancer is the highest. And again, that preventative around know your normal, self-checking, seeing the signs and symptoms, knowing what they are. I didn't even know what they were. I didn't know. So I reckon I had most of them when I do my talks in school. So the dimpling around the breast, the skin, the itchiness, the slight fluid loss. I reckon I had it all, but I didn't know that's what I was. Yeah, I didn't know. So for me, knowledge is power.
Yeah.
And being forearmed with, actually, I know now that if I get, and each month, if things change, then I've documented it and I can go and get help or speak to someone or just get it checked out. It does not mean that that's going to be a diagnosis at all. It just means I'm taking control. I'm tying the camel. I'm here in control of my body. I know what the changes are. I know that I can report on them. Because I think the hardest question is when you're sitting in a chair and the GP says to you, Mrs. Hussain, when was the last time you checked your breasts? I couldn't answer it. I just looked at him like, that's the hardest exam questions anyone's ever asked me.
Yeah.
I don't know. And he looked at me, he said, what do you mean? I said, I've never checked. No one's ever asked me to, told me, showed me. I've just never done it. And he was like, oh, okay. You see, there's an assumption that people think everyone knows how to do it and they do it.
Yeah.
But nobody does. And often I start my talks with how many of you check your breasts regularly, being the operative word. Nobody puts their hands up.
Yeah.
Nobody ever does. Not in school, not in adult community settings.
Yeah.
They just don't. They say, huh? And I'm like, okay, here's a boob. Try that. Here's a knitted boob for you. But no. So, but hindsight's such a great thing, isn't it? You learn.
Yeah.
And you think, wow. And then you learn about your sugar, your diet, having balanced fluid, even just drinking water. I didn't know the importance of making sure you're hydrated, even to help with weight loss, or just in, to ensure you're living a balanced life.
Yeah.
Not everything is about weight loss. It is about grounding yourself of being optimum health and giving yourself the best chance and living your best life. And that's what I think cancer has given me now today, 10 years forward, is I can make choices without any shame or regret and live my best life.
Yeah, and that you are definitely doing. I wanted to touch upon menopause, because you were 45 when you got your cancer diagnosis, and that is a perimenopausal period, depending on the person. Again, it's different for everyone. Did you know anything about the menopause? That's the first thing.
No, 10 years ago, I don't think the word was mentioned. And especially now, like in the workplaces so much, I didn't know anything about the menopause or what perimenopausal meant. Because my cancer was a estrogen hormone informed cancer, I sort of got put artificially into early menopause. And it's interesting because the side effects, and some of them sort of parallel to chemotherapy. I mean, there's one, in terms of vaginal dryness, I just assumed that was all to do with the chemo. But it was much later, and actually at the Rotti Club, that when we were talking about these things, because it was a safe space, I realised that was all to do with the menopause.
Yeah.
It was nothing to do with the chemo. In my head, I'd put it down as a side effect, and that uncomfortableness. But what I didn't realise was, well, if I spoke to my GP, they could have helped me.
Yeah.
They could have made my life less uncomfortable, painful, difficult. I felt like I'd always got thrush. I felt like I was really unwell all the time. But they could have alleviated some of those symptoms, symptomatic. So I think, and then I was put on tamoxifen, which is the drug you take. I was told to take it for 10 years because of my age, but at a 5-year point, they did another blood test, and that's when they said that I'd gone through the menopause now, and then they can change the type of drug you need to take as active treatment.
Okay.
And then I changed over to letrozole, but I took that for a few years. And then now, 10 years on, I'm like, okay, I don't need anything. So I think awareness is key. I'm sure, again, our mothers went through all of this and they just took it on the chin as part of life.
Yeah.
What you do, you get a bit hot and sweaty and you're getting old and you're tired and, your periods dry up. But actually it's a part of life, but you don't need to suffer.
Yeah. I didn't know anything about it. I didn't know my mum was going through it, and I didn't know anything about it until I'd say fairly recently. And when I say fairly recently, probably in my as soon as I kind of started hitting 40, I didn't really know much about what it was. So it's just, I just feel like if there was more information out there and we are just informed, I don't know where it starts. It definitely starts in schools.
Yeah.
Yeah, for
There's
sure.
something about life cycles and transition.
Yeah.
And we've got many transition points in our lifetime.
Yeah, definitely. So I want to ask you if you would be giving advice to women or men out there on advocating for themselves, because, that is a huge part of being diagnosed and not being misheard and all sorts of things that we hear about now. What advice would you give to women?
So my advice to anyone is trust yourself.
Right.
Trust yourself. You know your body better than any clinician, any medical service. So be aware of your symptoms, be aware of the changes in your body, know you're normal. And then use your voice, find your voice. Really be your champion and advocate. Don't silence it or think, I don't want to bother the doctor. I don't want to say this. No. If you feel something isn't right, ring up, see somebody, make an appointment, talk to someone, ring a charity, do whatever you need to do to satisfy yourself that you've been heard. Often women tell me that they presented to their GP 3 or 4 times before they were taken seriously.
Yeah.
And that's diabolical. We know that the outcomes for Black and minority ethnic women are worse in terms of pain threshold, in terms of treatments, in terms of disparities, in postcode lottery, in terms of access. It's not good enough. It's just, we have to be, I think my biggest advice to any male or female would be, when something's not right in your body. So don't put it to the back of your mind. Go and speak up. Trust yourself because you are right. Don't ever deny yourself of trusting yourself, and then seek the right professional support and advice. Google's great, but it's not great.
Yeah. Because
I think it creates much more fear and pandemonium in yourself. So what I even we're not, clinically, we're not clinicians at all. We're a charity voluntary group of volunteers with lived experience. And my always to everyone is, listen, if you feel something's not right, I want you to make that appointment today, or ring in and speak to a nurse, or contact your breast cancer nurse, or your CNS clinical nurse specialist, because they'll be able to advise you and talk about next steps, or think about, okay, a lot of tests may need to happen, but that doesn't mean the outcome is going to be awful.
Yeah.
That can reassure you. One of my oncologists used to say, he goes, I'd rather prescribe the test and give you peace of mind than leave you thinking, what if? And that's the powerful thing here, is that, yes, we know the NHS is stretched and there's long wait times and there's challenges, but you're important to them and they want to help you. So there's always a way. There's always, there'll be drop-in surgeries. If you look at the new 10-year plan for NHS, it's from hospital to home, thinking about how we can ensure people live longer and happier in their own homes. And this is where, again, the Macmillan strategy talks about long-term conditions, and it's managing you to know. Only I know when my feet are really bad, or my arthritis or my neuropathy is not great. I've got a flare up. I'm not feeling good. I've picked up an infection. I need to put that call in.
Yeah.
And you will get streamlined with your GP. They will they will rate and say, okay, could you come in and see X, Y, and Z? But that's the main thing. So you have to make that first move, and never ever think that you're being troublesome or being a nuisance, because you're not. We need to hear the stories of South Asian men and women, but also, whatever you go through, I would say, don't hide away on your story. Keep finding your voice. Keep finding podcasters like you and other people, and opportunities to keep sharing your lived experience. That is so valuable. The value that's placed on lived experience to an encyclopedia or to a diagnosis that's medically informed and does not have, or a treatment plan that's not actually encountered what is it that the individual has been experiencing. You just can't do it. You can't do it alone. And that's where my advice would be is love yourself, know you're normal, and find your voice. They will be my 3 nuggets that I would say will keep you in good stead.
Yeah, that's great. Thank you. Samina, thank you so much for sharing your journey. It has been great. And I really appreciate you kind of, sharing it. That's one thing, because that's, it can be quite challenging to do that. And also sharing details about your health issues and so on. So yeah, thank you so much. I really appreciate that.
My pleasure. I'm glad I can help. And I think, also, again, I mean, I know you'll share the details of the charity, but if there's anybody out there that's just got a question and they're not sure, always ask. Always trust yourself and find your voice.
Yeah, of course. In the show notes and through the socials, I'll be sharing all the details as well.
Excellent. Thank you so much.
Thanks, Samina.
Thanks.